Good evening, everyone. My name is Britt Anaskevich. I'm the Strategic Public Financing Coordinator here at Children's Opportunity Alliance. It's good to see you all. So, Welcome to the webinar. We will share findings this evening from our second fiscal map research. These are FY24 investments in Montgomery County's early care and education system, and we do appreciate you being here, as well as your commitment to the early care and education system. So I'm here today with my colleague, Laura Jerome, Manager of Strategic Initiatives, managing all things tech, as well as supporting the evening with the child data. She will be sharing some child data and the state of affairs in Montgomery County for access and affordability and other common agenda strategies. Um, we're going to just shift to our agenda here and show you what we're going to be discussing tonight. We'll share findings from the FY24 fiscal map. We are also going to share some investments across fiscal years, FY22 to 24. We'll discuss these investments in the frame of the common agenda strategies. We'll talk about next steps for system advocacy, what this means, and we'll show you how to access this report and to dig into our searchable database where you can see all of the funding streams identified. Good to see you, Jim. Glad that you could join us. We really want this to be an engaging conversation. And what we'll do is share some findings and then we'll stop along the way and we'll open it up for questions. And you can either come off mute to ask your question if you're comfortable, or you can just add it to the chat either way. So we want to just get started with grounding us in some key takeaways. And so we'll revisit these at the end of the presentation as well. So early care and education, it's one of the smartest investments that we can make. It truly is an economic imperative, and this is usually a 4 to 9 time return on every dollar invested. Despite post-pandemic funding in the system increasing 28% between these fiscal years, FY22 to 24, and innovative county programs being launched, the needs of children and families and the workforce are still not fully being met. With this in mind, we are advocating for a dedicated, sustainable funding stream to meet the true needs of children and families and the workforce in Montgomery County. This dedicated funding stream, we believe, will sustain the system despite difficult climates, budget climates, and changing political forces. And our youngest residents will be made a priority alongside other necessities such as housing and food access. Like I said, we'll revisit these at the end of the presentation. But before we jump into the fiscal map findings, we want to share a little bit about Children's Opportunity Alliance. So here's an overview. In 2022, through legislation, the Montgomery County Council designated the Alliance as the Early Care and Education Coordinating Entity. And here's our vision and mission. We believe every young child in Montgomery County should have an equitable start in life, creating a stronger future for us all. And our mission is to connect our community to build an equitable, accessible, high quality, and sustainable early care and education system that narrows disparities and puts all young children on a path to reach their greatest potential. The Alliance maintains a 360-degree view of the system, partnering to influence programs, policies, funding, and other priorities for children birth to 5 years old and the adults who care for them. So digging into this fiscal map research, first we wanted to show you what a fiscal map is. So a fiscal map asks the question, who is investing, how much, and for what purpose? It's research that tracks federal, state, local, and philanthropic dollars being budgeted and spent on the 0 to 5 population in the county. We wanted to understand the funding across the county's early care and education system because, as we know, budgets reflect an investor's priorities and can show what is being supported as well as the gaps. And this helps inform decision making about how to better resource the system. So for this fiscal map, I researched fiscal year 2024 investments in the system, and then we compared it with previous fiscal years, 2022 and 2023, to analyze trends. And every year we do this fiscal map research, and this informs our advocacy for strategic financing and system change. So we want to next show you what's included in the report and what's not included. So moving to methodology and our limitations, as we mentioned, we expanded our research from last year's fiscal map with FY22 and 23 investments, and this year added 2024. Our process includes analyzing publicly available budgets, requesting information from the state through the Freedom of Information process, and requesting funding details and expenditure data directly from many local partners. While we tried our best, we know that we couldn't get an accounting of every dollar spent. And you can see the full details of both of these in our report on our website. This year-long process attests to the complexity of the number and types of decision makers and budget holders we made contact with in order to gather this data. Now I'll hand it over to Laura to talk about a little bit more about our child data.
Thanks, Britt. So the Children's Opportunity Alliance works to analyze data that helps us understand the needs of the youngest children in our county. I think many of us know Montgomery County is the largest county in Maryland with over 1 million residents, and it is continuing to become increasingly more diverse in terms of race, ethnicity, and primary language spoken, which can make effectively serving children at scale a challenge. So children 5 and under now represent about 6% of the total population. So right after this report came out, a couple days later, the 2024 census data was released by the federal government. And the birth rate in our county is indeed continuing to decline post-pandemic. So our report, if you caught it, includes a stat that the kids are 7% of the total population, but that is down to 6% now. And many of the young children in our county have needs that are not being met. More than half of children are not entering kindergarten, demonstrating readiness. 56% of children are living in families with incomes below the self-sufficiency standard. Many children face food insecurity and housing insecurity, and we can only assume that that situation is getting worse today. Next week, we shall see what happens. But to advance equitable outcomes, it's essential that children are supported in holistic ways from birth. We have a lot more work to do to improve these conditions for young children and their families. So I'm going to take a look next at our community's common agenda, which attempts to address some of these system inequities. Our common agenda is really a roadmap built by the community for the community. It reflects hundreds of voices across our county focused on what our early childhood system needs to thrive. A year ago, we set out to engage community members, including many of you, in prioritizing the actions that we can take that will most move the needle on ensuring that young children and the adults that care about them are thriving. We set our sights on an ambitious goal. By 2030, 75% of children will enter kindergarten demonstrating readiness. The common agenda represents a vision for change shared by all participants that includes a common understanding of the problem and a joint approach to solving that problem through agreed upon actions. It's focused around 4 key strategy areas: expanding affordable access to high quality early care and education, improving family engagement and navigation, advancing the ECE workforce. And when I say ECE, that's short for early care and education, and advocating for systems change and funding. So we facilitate a work group focused on each one of these strategies, and the work groups create and lead an implementation plan to reach the goals and targets within each strategy. To learn more about the common agenda in our work groups, check out our website. I'll put the link in the chat. Back to you, Britt.
Thanks, Laura. So, we want to share what we found in the fiscal investments. And first, we'll start at a very high level, and then we're going to drill down and talk about funding for each of these strategies. So, what did we find? Here's the total pot of funding. These charts break down the funding we identified by its original source: city, county, state, federal, and private philanthropic. However, the data we receive from DHHS and MCPS, Health and Human Services, and our school system, two of the largest recipients and administrators of funding in the system, they are able to do so much blending and braiding of funding to support their programs and services that it wasn't fully possible to break down all of their budgets. So you can see them here as blended pots. They represent funding that includes a combination of federal and state funding. And you can see here that the work of caring for and educating young children is an expensive undertaking. At least $340 million per year in public and private funding was spent in Montgomery County. Yet compared to the school system, which received $3.2 billion in FY24, it seems quite modest. Not shown here is the parent contribution. The majority of money in the early care and education system comes from families paying to access services, with tuition costs eclipsing all public investments, and their payments for childcare alone add up to over $400 million. Also, you will notice that the largest source of funding is from the federal government. Those are the white lines, bars, which has increased over the years, mainly for direct assistance programs for food, health, financial support, and more. Also, MCPS is the largest recipient of funding for children 0 to 5, and this has increased since FY22. Also important to note is that private philanthropy usually steps in to fill system gaps. And in our case, though, it's less than 1% of overall fiscal investments in the system. So we're going to just, pause here for a second and have you take a look at this so you can take that in. Hopefully you can see most of the investments in there because we're going to start drilling down in even more detail. So looking at more detail, safety net programs such as food assistance like SNAP and WIC, and childcare scholarship, then the childcare scholarship, which as we know is the childcare subsidy for income eligible families. These grew substantially in the 3-year period between FY22 and 24. As the economy shifts and funding is potentially cut or frozen in the case of the child care scholarship, we need to pay attention to the impacts on overall family budgets. Also, in FY24, Montgomery County introduced many innovations and updates to supports in the early childhood system, and these require reliable and expanded funding to be sustained and scaled. Also, demand for early intervention and special education continues to grow post-pandemic, costing nearly $75 million in FY24. Funding for aligned services such as mental health supports and behavioral needs training for educators, these must also grow. It's important to note that while $200 million was spent on efforts to increase access and reduce family costs, only a third of children in income eligible families received supports for early care and education. We also know that educators are the backbone of quality early care and education, yet our workforce suffers from inadequate compensation, causing high turnover and continued workforce shortages. Excuse me. We identified fewer than $5 million of investments that support the workforce. Also concerning is the low number of available public grants. Fewer than 3% of the more than 1,200 ECE providers in Montgomery County have accessed these. And while investments in Montgomery County's operating budget grew over time, the overall budget also grew, leaving the share of the budget for children under 5 stagnant at around 2%, though they represent 6 to 7% of the population. Our research also focuses on investments made in the 4 common agenda strategies. So we're going to drill down on these. First, starting very high level to give you an overview of change over time, what we found in tracking investments is that the largest amount, $203 million, is in access and affordability, yet gaps still remain. The next largest investment, 112 million, you'll see in the other supports for children and families. These are the direct assistance programs to families. And the third largest investment is $14 million, and that's for family navigation. The fourth largest investment is nearly $6 million in support of advocacy and system change. And then the lowest amount of funding that we identified was related to the workforce, which is $4.2 million. Next, we're going to delve a little bit deeper into each one of these. And after we review these, or at least halfway through, we'll open it up for questions. So you can then add your question to the chat, or you can come off mute and ask that. So first, we're going to start with the state of access and affordability.
Our vision is that every family who wants to enroll their child in childcare should be able to do so. We want to expand access to high quality early care and education programs by reducing the cost and removing barriers for families. There is a lot of work to do to get there. Currently, there are only enough licensed seats in the county to serve 59% of children under 5, and it is much worse for infants and toddlers. There are only enough seats to serve 19% of our youngest kids. And yet, roughly a quarter, or 9,000 of these seats, are estimated to be vacant. Did you know that the federal government recommends that for it to be considered affordable, families should spend 7% of their income on childcare? This would mean a family with one infant in Montgomery County would need to make over $450,000 a year to have center-based care be considered affordable. But the average family with children is paying 21% of their income towards childcare. The number one reason that families give that they can't access quality care is the price, and then a host of other reasons: location, hours of operation, cultural fit. And as Britt mentioned, importantly, we are currently only serving 1/3 of income eligible children with subsidized seats. And that's across all of the programs that have funding: Child Care Scholarship, Working Parents Assistance, Pre-K, Head Start, EquiCare. Our next slide is going to show the detail of that.
So our county's supply and demand study highlighted there are roughly 33,000 licensed seats. From our research, we know that in FY24, nearly 11,000 seats were funded across a complicated mix of 7 different programs. Outside of these programs, most of the early care and education seats, as we mentioned before, these are funded by parents, 68% or 400 million. So we're going to pause here and you can let you take this in. We'll just highlight a few things to help you read this slide. So after family tuition payments, seats are largely funded through the Child Care Scholarship Program at 14%. That's the blue, the kind of gray blue color there. And this is through federal and state funding administered by MSDE. And we know this funding is frozen right now, and we have a wait list, partially because it has grown so much over the past few years. So MCPS pre-K in the purple and special education pre-K in the burnt orange color are right behind that, with a combined 12% across these two types of seats. And adding up all the funding, public funding across these seats represents $176 million. So we'll just pause so you can take this in. Okay, as we move on to the rest of access and accountability, affordability. These are additional investments in access and affordability. And so I'll just highlight a few of these. $19 million was invested by the county for facility refreshers through the Child Care and Public Spaces program, and also the construction of the Up County Early Childhood Education Center. Nearly $3 million from the federal government for child and adult care food program. These are reimbursements for educators for meals and snacks for children. Nearly 1.3 million from the state for the Child Care Capital Support Revolving Loan Program that provides low and no interest loans to child care providers. This helps them renovate, expand, and maintain their businesses. And then also you can see state funding, 1.1 million in Excel's bonuses for childcare educators. And $1 million from the state in therapeutic childcare grant funding for children who need supports with medical and physical needs. And there's many more here. And so, though this is a large amount of money, $27 million, we know that there are still very big gaps in need and in funding. And so we ask ourselves, what would it take to improve access and affordability? And so we did do some cost estimates here to give you a sense of what it would cost to implement strategies that increase kindergarten readiness. We thought we would try to cost these out, universal pre-K for all 4-year-olds through a mixed delivery system, regardless of income. This would cost about $200 million per year. And also, we know the county spent nearly $2.2 million in the new EquiCare subsidy seats grant program to serve 75 infants and toddlers in licensed childcare seats. But if we wanted all Montgomery County infants and toddlers in this program who are at 400% of the federal poverty level to receive this support, it would cost over $420 million per year. And then another idea we had was let's provide subsidies for all 0 to 5-year-olds who are income eligible. And we calculated that would cost $585 million. This is $525 million more than what we currently spend. So it's quite a bit of money here. We do have some additional ideas. I'm sure you have additional ideas too. We would have to cost these out. An important one here is considering expanding local child care subsidies to cover unemployed parents. And then, of course, building capacity to support community-based child care participation in pre-K. So leveraging that state funding for pre-K. And so we're going to move on to family navigation and talk a little bit about the state of family navigation.
So it's estimated that 1 in 6 children are affected by developmental delays, learning disorders, or behavior and social emotional problems. Only a fraction, about a quarter of these children, are identified as needing help before elementary school begins. Earlier support can lead to better outcomes as children grow and develop. Um, on equity, in surveys and focus groups for the recent Montgomery County Supply and Demand Study, non native English speaking and immigrant families reported that they had more trouble finding information on potential childcare options, more trouble understanding how the childcare system in Montgomery County operates as a whole, understanding what options or resources are available, and trouble understanding that some may have wait lists that require searching for care months in advance. One example of a program is that the county is working to expand the basics from a pilot in one zip code of Gaithersburg to the entire county. The Basics is a program that provides public awareness messaging to promote healthy development in children and provide resources for parents. It includes a text message program that it gives tips to incorporate early childhood learning into everyday routines. There are nearly 70,000 children 5 and under in our community, but only 496 parents signed up for this free program last year. So again, we have a long way to go to scale the resources that we have that are already working. And then lastly, a survey conducted to inform the Montgomery County Strategic Plan to End Childhood Hunger found that the most cited reason for not participating in programs such as SNAP was, I don't know how to request help. I don't know how to request help. What if we could change that? What if we could make sure that families knew what is developmentally appropriate and best for their children, and then knew about all the available options to support them so that they could then make an informed choice?
Thanks, Laura. So, looking at the fiscal investments in this strategy, um, so we thought it would be important to show these cumulatively. It's $14 million, and some of the large investments are the library's early literacy programs at 7.8 million. Community Connects, which is a DHHS online benefits and subsidy portal, is 1.7 million. There is also a $1.4 million investment in the perinatal program, which provides home-based services to at-risk pregnant and parenting families. We also list here the Judy Center at 660,000, and then family involvement centers at 560,000. So we do show increases or decreases over time. And so that's the last column here in each one of these charts. But really, the larger story, just like access and affordability, it's that despite these fiscal investments, these large fiscal investments, 27 million, access and affordability, 14 million here. I'm sorry, 200 million, access and affordability, 14 million here. Families are still experiencing access barriers, and we need more opportunities for them to understand how the system works and how to navigate these services. So while they're really good efforts, there is room for improvement, and funding is needed for that. So, what would it take, though, for family navigation to improve? And so we started thinking about this, and we know that home visiting, as I mentioned before, is one option for us. It's an evidence-based program that improves family engagement, education, navigation of resources. So we looked at a home visiting model called Family Connects. It's a universal nurse home visiting model in Frederick County, Prince George's County, and certain zip codes in Baltimore City. And we calculated that to implement this model in Montgomery County, it would roughly cost $7.8 million per year. And then other ideas here would be to cost out launching a community ambassador training program to really spread the word about these services and supports to the community, revising or building new resource directories, expanding existing programs such as the Basics campaign, which Laura mentioned before, as well as Imagination Library and others. And so before we continue on, we're going to stop here and open it up for questions. So you can come off mute or put your question in the chat. And I think we do have some questions in the chat already. So Jim is asking a question: how much government money is actually available and goes unspent each year because parents do not know how to access it? Yeah, Laura, thank you. Thank you for responding to that. Laura said, I can't even begin to know how to calculate that. Yeah.
There are some
A good
examples
question.
of programs that were appropriated more than they expensed. An example of that when we get to workforce is how much the county set aside to pay for scholarships, and there were just less people eligible than they expected in order to get there. But going through appropriations and expenditures is a really detailed and nuanced process. But it is important because year over year, if you spend less than you appropriate, they're going to start appropriating less, right? Less will become available if there's not enough demand.
Yeah, good
Pretty thing to
question,
think
Jim.
about.
You know what's also, Laura was sharing earlier, the number of vacancies in our childcare seats, among our childcare seats. So, I mean, we could do a cost estimate of that. How much money is that? You know, and so I don't think we've looked at that yet, have we, Laura? How much
Mm-mm.
is vacancies costing us? Um, any other questions about these two common agenda strategies so far, or anything else? The total pot of funding, parent contribution, and Doreen saying we have vacant pre-K seats that we have not been able to fill. And so, Doreen, can you share a little bit about why that is? What is the barrier?
I'm coming. Can you hear me?
Yeah, yeah.
Thanks,
Okay.
Doreen.
Um, so it's complicated, but recently, oops, gotta turn this down. You're gonna only get an echo, probably having tech problems. But recently at a meeting with MSDE, certainly fear of families who speak a language other than English at home. And that enrollment is down all over the state. And that is a large number of the children that are looking for pre-K seats. We did get the seats we're having trouble filling. We did get them late. It was August before we started, advertising for them because we weren't anticipating having them. But I could send a long list of everything that I've done. I've run out of ideas and places to contact. Have been surprised that social workers at local hospitals, folks at the immigration centers, other places like that I've gotten the opportunity to meet with. Pastors of churches. None of them had any information about this program. I seem to be the first person who had reached out to them. And that's good work. I mean, they might, now moving forward, it might help next year. But few programs have somebody dedicated like me who can spend so much time on this. I would, I told my supervisor I was spending about 3 hours a day trying to do outreach, 3 hours a day, and I
Wow.
have not been successful. So I don't want to sound discouraging. I just need new ideas. I'm a big backer of the pre-K grant, and I'll stop talking now.
Thanks, Doreen.
Yeah, thanks, Doreen. It's a family awareness issue in a lot of ways and a systems level. So something that
Yeah.
we're hoping to work to change. So Joan has a question in the chat where she says she noted that the least funding seems to go to help educators. And as we've pointed out, educators are poorly compensated. Can you comment on how that feeds into this whole challenging system? That would take an hour-long webinar, Joan, just to answer that question. But we certainly think about access to childcare as a three-legged stool that you need to expand affordability, family awareness, and quality. And the quality of a program is very contingent on the workforce. And, because so much learning in the early years is relational. And, and the workforce has a lot to do with safety. And in our state, we have certain ratios that regulate the how many educators have to be present with the children. So you need to have staff there in order to keep classrooms open and to be able to offer those seats to children. So there's a lot that's really intricately connected, and it's hard to separate the impact of the workforce separate from the whole question of access and quality. But that's a good segue for us to go ahead and talk about the workforce. So why don't we go ahead and share some data on the workforce, some funding, and then, oh, you want to go, Rosanna? Okay. Yeah, you should answer that. Go for it.
Sorry. Before you go to the other, I am in many group. I am not part of the pre-K expansion yet because 2 times I applied for pre-K expansion with MSCE, but I know I have successful. but in my opinion, I saw all the data. I was reading all your paper. But NCPS, in my opinion, I'm sorry, I am in Montgomery County. Why NCPA apply for pre-K expansion? We have a lot of family childcare educator apply for pre-K expansion. We had a lot of center like Tracy. They had three great center. When NCPS apply for a money for pre-K expansion, we are in competition, where the children is going. I have so many fellow who are running a pre-K expansion program. They are excellent. So sometimes it's like there are so many children they need to go a good program. I don't want to say NCPS is not good, but is NCPS had a money like pet program or they had Head Start program, why they need to apply for the money for pre-K expansion program when we had a center, we had a family child care educator, they want to be part of the pre-K expansion program. This is an opinion, though. That's it.
Thank you, Rosanna, for sharing your opinion. I think it is, you are not alone in having those thoughts. And what we advocate for is pre-K through a mixed delivery system. That's the foundational belief of the Blueprint for Maryland's Future legislation at the state level. And we want more free pre-K seats in high quality settings, both in public and private, for our families, because our families and our children need that. However, we really want to do it through a community plan, right? Before MCPS expands and opens new pre-K classrooms or opens new early childhood centers, we want them to understand the impact that that's going to have on the childcare community in that close geographic area, and make those decisions about expansion and in partnership with the childcare community, because it is one system that is so intricately connected. Yeah. All right. Thank you. So we want to make sure we get through the data, and then we'll have more time for questions. All right. Workforce. So our vision is for a future where the early childhood workforce is prepared, retained, and equitably compensated in order to offer high quality experiences across all the settings linked to child and family well-being. But right now, the average child care center educator makes just under $30,000 in Montgomery County, which falls more than $86,000 short of the self-sufficiency standard for one adult with two young children. This also creates a pay gap between a community-based lead teacher and a first-year public school teacher at MCPS of over $26,000 a year. This issue, amongst others, means that we are losing more ECE educators every year, and we're having trouble recruiting new ones into the profession. Maryland lost more than a quarter of our workforce during the pandemic, and it's been hard to get back to sufficient levels. There continues to be churn, with the turnover rate for educators being higher than most other industries. But by 2030, we're hoping to both recruit new people into the workforce and make efforts to retain the great educators that are already working, so that we can have about 12,000 or more educators in this county. Back to you, Britt.
Thanks, Laura. So let's look at the fiscal investments for the early care and education workforce. And so here's what we found in FY24. And then again, we have the trend over time in that last column over there. There was in FY24, there was close to $4.2 million. And as Joan pointed out, that's the lowest of all the funding that we identified. Some of the largest investments were a combined $1.7 million in federal and state funding for the Montgomery College ECE Alternative Certification Program, and this helps individuals become certified as early childhood educators. Also $842,000 in county funding for the Montgomery College Early Childhood Education Department, and then the state funding directly to educators in the amount of $701,000 for the Child Care Credential Program achievement bonuses. And again, just like access and affordability and family navigation, these investments are a really good start. Our research and cost estimates show, though, that there is still a need for a substantial amount of money to turn the system around. And so we're going to delve a little bit deeper into that. So what would it take for us to advance the workforce? So to create a pay equity fund in Montgomery County, it could take as much as $94 million for all lead teachers in community-based settings to be on par with the salaries of MCPS teachers. This does not account for or include assistant teachers or administrators as DC's Pay Equity Fund does. So really, to do this right, we would have to go back to the cost estimate and increase that. It could actually cost more than $100 million per year. We did look at educational scholarships. And if we tripled educational scholarships in Montgomery College's early childhood education department, just as an example, it could cost $1 million per year. And then we also had some additional ideas below that we would still need to cost out, including access to benefits, the workforce having access to health and retirement benefits, also implementing a state-level career ladder and workforce registry, expanding and sustaining the Shared Service Alliance, and then enhancing the pipeline development. And so we do have a quote down there. Just want to read that out. Again, educators are the backbone of quality. Without compensation parity, classrooms close. And so we're going to shift now to look at additional early childhood investments. So, as we mentioned, the second largest amount of funding was in additional childhood investments, and these total close to $112 million. And I'll just highlight a few. So SNAP, as you may know, is the Federal Nutrition Assistance Program. And in FY24, there was nearly $49 million for this program. For WIC, the Federal Nutrition Assistance Program, specifically for women and children, $33 million. So that was really helpful. And then nearly $7 million for early intervention services for infants and toddlers, as well as $6 million for area health centers. There's many more here. As you can see, you can take a look at this. Many have increased over time, but as we know, just like all of the other areas of investment for kids under 5, it's not enough. It's just too many families living below the self-sufficiency standard, and we just need more funding. So we're going to shift now to what that could look like as advocating for funding and systems change. And so taking a look at this bucket of funding, we tracked overall system-wide efforts that coordinate, support, or otherwise are aimed at improving the early childhood system in the county. So these overall investments in FY24 were $5.8 million. You can see here DHHS, the Early Childhood Services Department, received $4 million in county funding for personnel and operating costs, and they manage and implement these important programs and services. Children's Opportunity Alliance received $1 million in county dollars for our coordinating research and advocacy efforts. And we also raised close to $380,000 in philanthropic investments. Also, the Early Care and Education Initiative, which is an initiative of the county executive, directed about $279,000 in funding across these various studies, such as the supply and demand study, the cost of quality care study, the workforce compensation study. And so that was really helpful in establishing a baseline of what the county needs. And so these are all of the advocacy and system change investments in FY24. On this slide, we're sharing a snapshot of the county's operating budget with the various agencies or initiatives that dedicate a percentage of their funding towards children under 5. For each of the 3 fiscal years, which you can see here in the columns, we show the identified amount spent on young children, the agency's total budget, and then the amount spent on children as a percentage of that total budget. And the final column shows how that changes over time. This chart shows our work and backs up our claim that only 2% of the county's operating budget is spent on children 5 and under, even though they represent 6 to 7% of our population. So next we're going to talk about what we recommend for systems change. So what will it take? Ultimately, if we want to improve access to early care and education, engage and educate families, and advance the early care and education workforce, we'll need to scale effective programs and services, create new programs and services that fill gaps, and make changes to system regulations, policies, and structures that currently hold inequities in place. We will need significantly more resources than are currently available, as we've previously shown. And we will also need to ensure that this funding is protected so that it is not eliminated in times of scarcity and prevents cutting programs and services that families have come to rely on. To be specific, these are some of the important next steps which we have already started to do. We've researched and built our knowledge and continue to learn from other places that were successful in creating dedicated, sustainable revenue streams. We've engaged diverse partners to establish goals, a timeline, and to develop a plan to answer key questions. And so here are those questions. What are we going to spend the money on? How much will that cost? Where will the money come from? And how will the money be governed and evaluated? We have engaged in research to identify viable local funding mechanisms to determine what would work in Montgomery County. And we need to build a cross-sector coalition and campaign infrastructure, including families, educators, businesses, philanthropic and other system partners, to really influence the public and political will to invest more in our youngest children. We'll be conducting polling and implementing a targeted communication strategy very soon. We're finalizing our search for a partner. Actually, we just did finalize our search. So we'll be moving on that shortly, that communication strategy. And we're going to need to leverage private business and philanthropic funding to implement this campaign. So how are other communities doing this? Let's take a look. So a number of communities and states in this chart from around the country have been successful in identifying dedicated funding to meet their goals for young children. Securing a dedicated source of funding can take months or years of preparation and active efforts. And we wanted to show some of these here. So many of us are familiar with DC's Pay Equity Fund, which is $42 million annually and was implemented in 2021. Baltimore, just up the road from us, despite huge budget constraints and opposition within the government around a funding mechanism for children and youth, implemented a Children and Youth Fund in 2016. And interestingly, the City Council overrode a mayoral veto on this, and they established a dedicated funding set aside, and a nonprofit in Baltimore City administers that funding. That's annually $12 million. And then way across the country in Sonoma County, California, Denver, Colorado, Austin, Texas, here are some initiatives highlighted, $30 million to $76 million. And so again, this is just a snapshot. Again, you'll receive all of these slides in the follow-up. But really what's important is that over 100 jurisdictions and states across the country have been enacting dedicated local funding streams. And so it's really, really encouraging. And so to wrap up, we just wanted to take a look again at our key takeaways. Again, early care and education is one of the smartest investments we can make. Despite the 20%, 28% increase in post-pandemic funding from FY22 to 24. And these innovative programs that the county launched, the needs of children and families are not still being met, as well as the workforce. And so we are advocating for a dedicated, sustainable funding stream to meet the true needs of our youngest children and families. And this is what you can do to help us with that. So next, we want to leverage the fiscal map findings. Please consider using this in your conversations with folks in the county. We too will be working on that. We are continuing to facilitate these common agenda strategic work groups. We're going to build a campaign, as I mentioned before, and mobilize a base of supporters. And we hope you'll join us. And really, we want to bring pay equity for the workforce and also ensure that all income eligible families can afford early care and education. So we're going to show you where you can locate this report on our website. There's also the interactive data dashboard that you can drill down on. Laura's going to load that and drop it in the chat. We want you to play around with these numbers. Click on the dashboard. You can't break it.
So, Britt, I would say, let me just take a real quick minute and show folks how to find this on the website. And then we'll take one or two questions before time is up. So this is our Children's Opportunity Alliance website. Under our work, you'll see the fiscal map. And of course, now it's going to be slow. So you can download the full report here at the top. You can read through the executive summary and our top findings. And then here we have a searchable database where all the data is available. And it'll make different graphs for you based on what you want to see, different types of funding or different recipients of funding. You could look at the different groups who receive the money over time. So there's lots of ways that you can play around and see the money in different ways compared to the last 3 years. And then down at the bottom, we have a place for you to share your thoughts. So after you spend some time looking at the fiscal map, we'd love to know what you think of it. All right, I'm gonna stop our share here and see if there are any questions.
Thanks, Tracy.
Hi. So one question I have for you when I was looking at and let's talk about the workforce, and I saw all the money, especially, I'm a part of Montgomery College. Is there any statistics about how many of the people who use that money to get certification in early childhood and actually landed a job in early childhood?
Oh my gosh,
Because with this
Tracy, what a can of
workforce
worms.
and the lack of pay, I'm curious as to, you got all this money. And I remember back in the day when I had my scholarship, it was, if I took this money, I had to commit to the same amount of time or years in early childhood. Otherwise, I'd have to pay it back. So I'd be curious to
Yes.
know. So you
Yeah,
have
both the
information?
county scholarships and the state child care professional development fund scholarships have requirements that you retain in you give service time in the field 1 to 2 years or the equivalent of how much money you borrowed. But what you're asking is a much deeper question about how effective this money is, right? Like, what are the outcomes of the money that we're spending? And that's really hard to do. We do not have a whole lot of data right now from Montgomery College on outcomes. So it's been a little bit harder to track the number of participants and graduates and whether they stay in the field, how long they stay in the field, things like that. So we're hoping to get more Montgomery College data specifically. But again, drawing conclusions about quality of outcomes to the amount of money spent is really hard to do. You're right though, that it's an interesting next step.
And my next question, sorry, I got like 3 or 4, but I'll try to keep it short. Tomorrow I might have the opportunity to be in front of Governor Moore. So if there was one thing or one pitch that you wanted me to say to him, if I get the opportunity, what would it be?
I have.
I can open that. Go for it, Rosanna. Yeah.
No. Please, Laura, maybe this is for you, not for me, but I want to tell you, Tracy, it's very important. We are talking about Maryland Child Care Credential. June, July, August, September, October. Now they say in December. The money is there. What happened? You
Oh,
know,
can I
they say
can I
they are.
give you some insight? Can I give you some insight to what happened?
Yeah, tell me because they say they are looking for a vendor.
The insight is, okay, remember when they shut it down? So that whole
Yeah.
agency, MSDE, all those people, poof, gone. Okay.
Mm-hmm.
The money came back and then there was no system in place or no people to work the system. So
Mm-hmm.
then with all, because you got NACI is changing their standards, what then means
Mm-hmm.
Excel needs to change their standards, which means credentialing needs to change their standards. So they had to find a different vendor. Now, to my understanding, they are working with University of Maryland to be the new vendor. So they laid dollars short and their promises, which we all know. And again, I'm a former MSDE licensing specialist, been there, done that, I can say it. You know, sometimes they put the cart before the horse. Okay, you're right. The money has been there, but the system was not put into place. And again, all the details, because once it's open, you know it's going to be a floodgate and everybody going to want their money and XYZ and make mistakes and everything. So they're trying to work out all those kinks. Now,
Mm-hmm.
should there have been forethought to know the money was never supposed to be taken out? That was the first mistake.
That's
So if
true.
never supposed to be taken out, then the agency would have never.
Everybody know. That's what made me upset because everybody know because they say, "Oh, what's a mistake? Oh, we forget to put them." No, they not forget. Everybody know they're going to cutting. It that made me like I don't want to be a number because I am Hispanic. I don't want to be a number because we are African American. I don't want to be a number because many
Yeah.
people they are lying to us. And then when the associate or the people they say, "What happened with this one?" or "What happened with the other one?" I say, "No, it's like it was a mistake." Or nobody know. Everybody know. Everybody know.
It's really
Entonces, what?
hard. So
It's
when
hard
funding is
because now,
inconsistent and it gets turned
see,
off, it is hard to turn it back on. Yeah.
yeah, but Laura, right now there are many early childhood educators. They not believe in MSDE because they are lying. They always
Yeah.
promise and promise and promise. We are okay in Montgomery County, but we are on the MSDE. Like Tracy said, she was especially before when they come into your program, they looking like a loop. What do you do wrong? There are another, especially they are so great. But Tracy, it's very important to say, you know what? We need to reset a little bit about MSDE because the educator, they are not believe in them. The other thing, there are so many new people, they don't know exactly what happened in Maryland. Because I was in a group when I need to explain what is large family childcare, like what is that? I don't know, Tracy, do you remember many years ago? I was driving in my car. Tracy was there. It was in a paper for Maryland Child Care Credential. We're revising the paper. I went to Baltimore once a week. Nobody paid me my day. Nobody paid me my gasoline. I put my car. I spent all day in Baltimore revising one paper for the family childcare to have the Maryland childcare credential. What's a paper? There are no computer. There are no nothing. I- all the provider, all the educator there was happy because they recognizing everything they doing. Now with the system, what Maryland Excel, what this one, the AI, blah 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 blah. Come on, so many years ago, there are no computer. We do in a paper. You know what? So many years ago was functional, and now with computer, everything is. I know it's some money. I know it's late. It's almost 8 o'clock. Tracy,
Yeah.
please. Sorry.
Rosanna, thank you so much. Tracy, thank you so
Yeah.
much. Jim, Joan, Doreen.
I know
Um,
we're at time, so if you have to go, then please go. But I feel
yeah,
like I can't miss this opportunity. Tracy, I would say if I was meeting with Governor Moore tomorrow, I would say that Maryland made a foundational mistake in having the blueprint for education not start at birth. That learning for children starts in utero, and 90% of brain development happens before the age of 5. And we invest so much in K through 12 education, and we as a state would have a huge return on investment if we had a plan to invest in early childhood education in a comprehensive way. And that's by improving access through child care scholarship and pre-K through a mixed delivery system, and supporting quality, supporting the workforce. And it all needs to be done. There's no one silver bullet that fixes it. They need a comprehensive plan.
wow. Thank you
So
so
thank
much.
you. I hope you get to meet them.
That
Thanks,
was so
Joan.
great, Laura. Thank
I'll
you
push
so much.
myself to the front, that's for sure. So
Yeah, do it, do it.
if not, then we've got the night at Annapolis again, notifying our elected officials, the fact that you had those states, once Texas, $76 million. You know, I'm like, come on,
Yeah.
we're Maryland. What's
Yeah.
the problem?
Tracy,
I don't
that's
know, but
what I'm thinking as I listen to this. You gave us all those examples of these states that do have dedicated funding streams, and we think we are so much better than all of them. And
yes.
we're way behind. And
Well, I will say for context, there was a briefing at in the House of Delegates this morning about childcare scholarship, and they were talking about the New Mexico model of universal childcare and how we can get it.
New
And they did
Mexico, which is
say,
rails last in the country on.
well, they said New Mexico has budgeted $500 million for it for this year. $500 million is what we're spending on childcare scholarship right now while it's frozen because we can't afford to spend any more than 500 million. And they said for Maryland to do universal childcare just for 0 to 2-year-olds would cost $2.6 billion. Right? So New Mexico can do it because they have oil and gas revenue for $500 million.
They're a pretty
Maryland,
poor state, Laura. So I think we have to look at it in comparison to lots of things. But your point is taken.
Yep. Yep.
yeah, scale. Yeah.
So
Yeah.
this is exciting because we're talking about fiscal investments like important, it matters. And you're all going to receive these slides. We want you to play around with the dashboard and really drill down on the funding streams, ask questions, use this presentation, use data from this. We can help you make presentations as well. If you care to access this data and make a point about how much we really need, and just join us on this journey for sustainable funding because it's going to take a while, but we're going to do it. We're going to get it for Montgomery County, and we need your help on that too. So thank you all for joining us. Thank you for participating. Please send us questions and follow up. If we didn't answer them, we didn't have enough time. Really appreciate you all. Hope you have a great night tonight. Thank you so much.
Thanks, everyone.
Bye.